Hi, I am Jason. I'm going to be discussing the subject of depression and how it has detrimental effects on the body and the long-term effects that can pertain to it. Okay, I'm going to discuss the problems with depression. Depression, how it greatly impacts the well-being of life and detrimental effects of the long run. First of all, depression has characteristics of making the body and mind imbalance. Clinical depression is associated with long-term effects of sadness, making it hard to make decisions, and remaining happy. Examples include sleeping too much, procrastination, sleeplessness, hopelessness, and difficulties with concentration, just to name a few. Now, the long-term effects of depression greatly affect health in many ways. To name a few, let's discuss that. Chronic fatigue and insomnia. Depression has an impact on serotonin, causing changes in brain activity. Examples: neurotransmitters, which send messages to other neurons, which makes it responsible for messages in the brain, how we react to situations, hinder our abilities to reason effectively. Also, back pain and lower levels of sex drive occur with high levels of depression in the long run. Depression has led to very harmful side effects on physical illness. Examples are stress, hormones, and cortisol. Cortisol can be identified as the fight or flight response. It isn't necessary to warn us of threatening events. However, too much cortisol puts people up for risk of heart disease due to weaker immune systems, to fight infection due to the stress levels increased due to depression. So high levels of depression actually weaken your immune system, and in the long term, people that are in their older ages have a hard time fighting diseases because depression decreases the abilities to fight infections and weakens the immune system as well. However, despite long-term suffering, there is still hope to reduce the side effects and live with a more quality life. There's help out there such as medications and therapy. A few examples are psychotherapy. Psychotherapy is a combination of cognitive behavioral therapy and self-talk. Practices which utilize thought replacement using internal dialogue. This is one of the most popular methods today. The environment is very therapeutic with other support group members partaking as well. Another method is electroconvulsive therapy, or ECT. The magnetic pulses from the electrodes penetrate the cerebral cortex. A few sessions of this procedure has been known to reduce cortical activities. The side effects of this procedure is quite minimum, but may require multiple sessions depending on response to the patient. Basically, they use electrodes to the brain, which causes electromagnetic waves to send impulses to help reduce the effects of the hormones which causes the depression, to help them live a longer quality of life. Many sessions can be facilitated in it to have higher results and greater results. Some of the side effects, however, could be a mild headache or vomiting or slight dizziness, but they have been known to be quite minimum, and it has been effective for most patients. Another method is medications. Now, medications have been on the market for many years and have been known to have proven their abilities to help people with depression. They play a big role in helping people's lives and cope with their serotonin levels and other brain activities and help stimulate them so they can have a more quality way of life. Some of them, to name a few: antidepressants have been on the market for many years and have been known to have very positive responses to brain activity. Examples are selective serotonin reuptake inhibitors, or SSRI drugs, like Zoloft, Paxil, and Prozac. All these drugs here have been proven effective on the brain to help reduce the levels of anxiety and depression in most people. With all the support out there, many people suffering from depression can find hope to live a more fulfilling life. It's important to know the symptoms and recognize them, and then take action and not wait too long for detrimental effects that can happen in the long run. After all, we only have one life, and that is it. Thank you.